Good morning. Welcome everyone to the 2020 Child Welfare Virtual Expo, or SWEVE as we like to call it. Thank you for being a part of this year's virtual event. This is a wonderful opportunity to connect with colleagues across the country on our continuous journey to strengthen and improve outcomes for children, youth, and families. My name is Jasmine Hayes. I've just come on board as the new director of the Capacity Building Center for States. In my previous experience, I served for over a decade in various leadership roles at the District of Columbia's Public Child Welfare Agency, and I'm delighted to join the SWEVE this year as a representative of the center. Before we begin, I want to thank our capacity building collaborative partners, the Center for Tribes and the Center for Courts, as well as the following organizations for their contributions to today's SWEVE: the National Child Welfare Workforce Institute, the National Resource Center for Community-Based Child Abuse Prevention, the Quality Improvement Center for Workforce Development, and the National Child Abuse and Neglect Technical Assistance and Strategic Dissemination Center. I would also like to thank the Children's Bureau staff who generously contributed their time and effort to help plan this event. And finally, a big thank you to the SWEVE planning team, including our talented speakers, subject matter experts, family and young adult consultants, and administrative staff. The partnership and planning for this day has been extraordinary and reflects a deep commitment to our shared vision for child welfare. So a special thank you to all of you. I'm excited to introduce this year's theme, Strengthening Families Through Prevention and Collaboration. In light of the challenges we face in the world today, building strong, prevention-focused child welfare systems that support children, youth, and families is more important now than ever. It's important to understand prevention as a framework that occurs along a continuum of 3 levels. Primary prevention efforts provide support to families to strengthen their protective capacities and reduce risk factors before they come into contact with the child welfare system. Secondary and tertiary prevention efforts focus on families that become known to our system due to increased risk factors for child maltreatment, or when child maltreatment has already occurred and we want to curb the likelihood of recurrence. A comprehensive system of care for improving positive outcomes for children, youth, and families should include strategies that coordinate resources across the entire continuum, from primary to secondary to tertiary prevention. In our work, it is important for us to prioritize the needs of children, youth, and families and focus our attention on preventing maltreatment and unnecessary placements into care. However, child welfare systems cannot do this alone. To be successful in building a prevention-focused system, we must collaborate with community-based partners, service providers, and other stakeholders as part of a coordinated community approach that integrates an effective prevention framework across the array of services and systems that impact outcomes for children, youth, and families. The presentations you attend today will underscore that each of us, no matter our role, can contribute to this crucial task and make a positive difference in the lives of the children, youth, and families we serve. Now, it gives me great pleasure to introduce Jerry Milner, Associate Commissioner at the Children's Bureau, who will kick off the first session.
Hello. It's such a pleasure to be with you here for the Virtual Expo once again, and I want to thank all of you for joining us here today. For the past 3 years in the Children's Bureau, we have worked tirelessly to promote an agenda of strengthening the capacity of families to care for their children safely and in healthy ways. Our efforts to promote primary prevention have taken us to practically all of the states in the country, where time and again we've had opportunities to sit down with young people who have been a part of our foster care system, with parents who have lived experience in the child welfare system. We've heard their stories. We've heard the words that they use to describe those experiences in sometimes very, very tearful ways. We believe very strongly that supporting our families and building their protective capacities is the most substantial thing that we can do to help families stay together and to relieve children and young people and parents of the trauma that often occurs through their experiences in our child welfare system. For the past few months, we have seen greatly exaggerated effects of the weaknesses in our child welfare system. The COVID crisis has exposed so many weaknesses that we must pay attention to now as we think about moving forward in the days past this immediate crisis. We've always known that lack of flexibility in our funding for child welfare services has tied the hands of state and local child welfare agencies to meet the fundamental needs of families. This lack of flexibility has never been more apparent than during the current crisis, with families not having access to housing, to food, to employment, and to other basic needs, often putting them and their children at great risk of child welfare interventions. We've always known that lack of modernization and automation in our court system has created delays in proceedings and lack of flexibility for families. Yet during this crisis, we've seen the critical effects of that lack of modernization and that lack of nimbleness when court hearings have been disrupted, delayed, or altogether stopped. Very importantly, we've always known that we allow young people in our foster care system to routinely age out when they turn 18 or 21 without the permanency of a family. Some after spending most of their childhoods in foster care, and all too young to be fully independent. The effects of that kind of lack of permanency have never been more apparent when we have seen college dormitories close and many of our young people becoming virtually homeless, or when college dining rooms closed, threatening our young people with the most basic of needs, food, or when the universities themselves closed and access to technology, and sometimes the technological equipment was beyond the reach of our young people. We've always known that we have not provided our children and youth in foster care with adequate family time with their parents so that they can maintain those critical bonds and relationships even when foster care becomes necessary. Never have we seen the effects of that more apparent than we have during the current crisis, where many of our children and young people have not been able to have the face-to-face contact that's needed to nurture those critical relationships. We have an amazing opportunity before us, as difficult as this situation appears to be. We have an opportunity to build on what we've always known and to look at the effects that have become more apparent over the past few months and design a path going forward that will allow us to strengthen families, that will allow us to help them build the resilience that they so desperately need in times of adversity. And we will all have times of adversity. I challenge all of us to think about these lessons learned and not to think about a new normal as just a slightly less resourced version of what we currently have, but to think about a new way of serving children, families, and youth as we go forward. Thank you very much. And now we have an incredible opportunity to hear from a panel of national experts that have been involved in very different ways with supporting our child and family serving systems as they shift more towards a prevention agenda. The exciting thing about this panel is that we'll get to hear what prevention looks like on the ground in our work with children and families and with communities. We'll hear it from a legal and judicial perspective, and we'll hear it from a broader systemic perspective as well. I'm so pleased to be able to introduce to you Amelia Frank-Meyer, who is the CEO of ALIA, Mike Cull, who is with the University of Kentucky, and Vivek Sankaran with the University of Michigan Law School. Amelia, I'd like to start with you, if that's okay. One of the things that we wanted to highlight today is the need to really involve the community and constituents in planning and development as systems seek to serve families in a new way. I wonder if you could just share a little bit about your experiences with that.
Sure. Thank you, Jerry. Well, we're really leaning into this idea of family and community co-design. So pressing even further than family voice or family engagement or family centered, and really taking a backseat to what families need and how families want to redesign what they need in a system. And so throughout the work in the ALIA Innovation cohort, we have used lived experience guides. And so someone who has grown up in the system or lost their children to child welfare placement is guiding systems leaders on what families might need in moving forward in new ways of work. We've also added an alumni innovation fellow to our staff to help us to guide those directions. But really, what I think we're looking at moving forward is thinking about how do we divest our power? How do we really move away from setting the menu, setting the table, and inviting people to our dinner in our home, and instead asking folks what they would like to have for dinner? And so really thinking about partnering with families, co-designing with family, co-designing with community, not just still holding on to all of our power and asking folks what they think about our great ideas or how they might change our great ideas. So thinking about those kinds of partnerships in new ways where we truly share power with families.
That's excellent. I can well imagine that a system that works in the way that you're describing would absolutely be a support to families when they need that. Could you share with us some concrete examples of what that kind of an approach looks like?
Sure. So an approach that truly partners with family is an empathy first, compassion first approach. It starts to think about concrete needs for families. And what I'm hearing from leading folks who are looking at systems redesign is really thinking about how do all families in sort of a universal precautions type way. You know, the ADA is just celebrating its 30th year anniversary. And with the ADA, we all benefit, right? So curb cuts help mamas with strollers, not just wheelchairs. And so thinking about that universal accommodations approach or universal access approach in child welfare as well. So there are things that all families need, right? All families need quality childcare. All families need good health care. All families need solid education. And so what are ways that we can create community conditions where people can thrive, where they can actually call for help and get concrete help without worrying about losing the most precious thing they have in their life, right? So, so what might that look like would be for families to have access to those concrete supports that they say are important, that they design in their local community, that they say these are the things that we really need in order to keep our families thriving. These are the things our family needs in order to continue to keep families safely together in communities. So, you know, what I really think is it's time for us to stop guessing what those things are. It's time for us to stop planning what we think other people need and really start asking them what they need and then deliver those concrete supports in local ways that are culturally specific and really listen to what families are telling us they need to be able to safely parent. You know, it's really a fundamental belief of mine that they know what they need. Families know what they need. And if we give them the opportunity to design those needs, they'll be able to better meet them than someone who's not living their life, you know? So letting people closest to the problem create solutions for the problem while we partner to deliver those solutions is really what it looks like moving forward. And so what I'm hearing a lot from leaders is this idea of, not just a hotline in child welfare, but hotlines and helplines. And how do we deliver real help in concrete ways to families who are struggling?
It's very exciting, Amelia, to hear you talk about child welfare through that lens. Not too many years ago, we would not be having that kind of conversation. Yet other fields that serve children and families have been on the prevention side of the agenda for quite some time. One of the most significant of those systems is the healthcare system and the public health system in general. Mike, I'd like to switch over to you for a minute here. You have a wealth of experience working with healthcare and public health systems. I wonder if you could share just a little bit about your experience with systems that have developed effective strategies to support the kind of transitions that we're looking for in child welfare.
Sure. Thanks, Jerry. And in thinking about Amelia's comments, most of the work we're doing is thinking about how we can borrow strategies from other industries to help our child welfare systems be more safe, effective, and reliable. Much of that work is focused on developing a particular kind of culture in child welfare systems that supports a workforce so they can go and do the kind of engagement that Amelia talks about, so that we can get some of the things out of the way and design more reliable child welfare delivery systems. The intersection with public health creates an opportunity for us to focus first on something that, one, is a fortunately rare event in all of our systems, but when it occurs, can have an outsized impact on our culture and really have an impact on our workforce and their ability to go deliver these services. And so that's the review of child fatalities. It intersects with public health and their prevention strategies as they're out reviewing in states and jurisdictions, counties. They're reviewing these fatalities that happen across their jurisdiction, and a subset of them are those inside the child welfare system. And then child welfare systems have a separate obligation to review those fatalities themselves. And as I said, when they're not done well, we know they can have an outsized impact on the culture. We have lots and lots of examples around the country of high-profile fatalities leading to commissioners being fired, to recently in Los Angeles County, 4 child welfare professionals being put on trial. So what we borrow specifically from these other industries is an approach that uses safety science and a systems theoretical approach to reviewing a child fatality or any really critical incident that happens in a child welfare system. In 2016, the National Commission to Eliminate Child Abuse and Neglect Fatalities made a specific recommendation for child welfare to look towards safety science, to borrow from other industries like healthcare and aviation in their approach to doing child fatality reviews. And so very specifically what they called for was having systems develop a quality improvement strategy that helps them borrow from other industries, look at system solutions to problems when they occur in the context of a child fatality. So this approach does 2 things. It allows us to dig very deeply into a critical incident, taking a look at what are the systems influences occurring, things like how do we team and communicate? What was the role of fatigue at the time of the fatality? What was the role of stress in the system at the time of the fatality? And then it also specifically, because you have to create in these reviews a context where people feel safe to speak up and talk. It specifically looks at creating a blame-free approach to looking at these reviews. Places like healthcare learned this long ago, that you can't bring a surgeon into a morbidity and mortality review and point fingers and blame if you expect that physician to talk about what actually happened in the OR, so we can learn from it so other people can avoid it. And so this takes us down the road of creating a new culture, a safety culture in child welfare, and moves us away from our fear-based practice that occurs when, for example, things like those child welfare professionals get placed on trial for a death on their caseload. What we know happens in those cases is the rest of the workforce becomes very fear-based in their practice. They go underground. They're much less likely to do the kind of work Amelia talked about because they're afraid to trust those kind of reunification efforts. And they're much more likely to bring kids into care.
Right. Thanks, Mike. You lead us in the direction of the importance of collaboration here. between child welfare and other systems out there in order to do our work well. But based on the experience that you've had, could you share with us some concrete examples of the kinds of collaboration that you see occurring between child welfare agencies and departments of health?
Sure. We're working right now with about 18 child welfare jurisdictions around the country. It's a mix of state run jurisdictions, county run, and also state and county child Department of Health. It's the National Partnership for Child Safety. We're working with all these jurisdictions to develop a systems theoretical approach to reviewing their child fatalities and then sharing a standard set of data across the partnership. The partnership is modeled after other quality improvement partnerships in places like healthcare and aviation. It's meant to be a member-directed peer-to-peer information sharing. It's not an external accountability model, which those are important too. We have many of those. We have many sort of child advocates or ombudsmen or second look commissions that, you know, their role is sort of external accountability into the child welfare system. This is an internal process and a peer-to-peer learning process. In about 5 jurisdictions, we actually overlap with a Department of Health that's doing the same work to develop the same kind of process. So what we're finding in those jurisdictions is, as we work alongside the public health department, who's there to do, you know, primary prevention strategies, we can help them look more deeply into the child welfare system, collaborate better, develop a process where the child welfare system can break down some of those barriers, create trust between the two organizations, and share the really important information that we need to be able to share about our organizations so we can improve them and be better at the work we do.
That's outstanding. I want to follow up with you, Mike, and with Amelia. Listening to both of you, I can't help but wonder a bit more about some specific action steps and what they might look like at both the practice level and at the systems level that might support stronger community collaboration in support of families.
Sure.
Go ahead.
I can take that piece of it for the practice level, at least. So thinking about stronger collaborations with families in terms of what does that look like moving forward? You know, we're really going to have to find ways of engagement with families who have either made it through our system and have a lot of hindsight wisdom to offer us, and currently don't have as much to lose for them to teach us what would have been helpful and what eventually ended up working for them. And so engaging with folks with lived experience in that way makes great sense. And I also think there is you know, jurisdictions and local communities vary so greatly based on what supports are available, the community culture, rural versus urban, the needs of cultural communities based in those communities. So, you know, there are some elements that I think we'll find be universal. But I really do think there is quite a local aspect to this, where we're going to have communities coming together with the CBOs, with the community-based organizations, with related systems of criminal justice and law enforcement and school and public health, and start problem solving together as a community. I mean, really up until this time, child welfare has often been, you know, kind of left alone to manage the challenges of children and families, or maybe not left alone, but really taken on that responsibility in a solo way. And what we know is that it doesn't work unless the other related systems are involved. And as we look at child welfare kind of in the broader sense of the community helping families to stay safely together. So, you know, I think there's going to be a movement where we build capacity for folks with lived experience to do design work in our communities. Yeah. I think there's going to be movement forward where we are working as communities to solve our community challenges, to keep our children safe in community and to support families to do so, where we're coming together across systems in ways frankly, we haven't done very well at up until this point. And really thinking about how do all of the elements of the resources and supports in our community come together to help families, because right now we rely very heavily on family separation as a tool of intervention. And there is so much more available and so much more we could do, as we are hearing from and will learn more from our families, in order to help families to keep their children safely with them.
Excellent. And you're in the thick of that. I know firsthand and have great appreciation for that. Mike, from a systems perspective, what would you say about that?
Yeah, I think that's really great. And I think I would just add that, we for so long have been stuck in a defensive posture when we're, as the child welfare agency, seeking out collaborators and working with some of those agencies that Amelia was listing off. And so I think there's some work to be done in our systems about being very intentional about how we build those relationships, how we break down those barriers. And if we can't be transparent and build trust into those relationships and create safety in the way we talk to one another as partners, we're going to kind of continue down this path of not sharing the information we truly need to be sharing so we can get better, because we're so afraid of really opening up our systems and talking about what's wrong with them.
Yeah, that is that's our history, unfortunately, and I thank both of you for those that kind of guidance as we go forward here. One of the partners that we've not yet discussed in this effort to improve collaboration to achieve prevention is our court partners. Sometimes in some places seems like the courts may be left out of the conversation, although we've worked very hard for the last 3 years to make sure that they are an integral part of that conversation. Vivek, I wonder if you could just share with our audience today your thoughts around the judicial system's role in supporting a shift towards prevention, and maybe provide us with a few examples.
Certainly, and I think, Jerry, you're absolutely right that traditionally courts have been reactive, right? Mm-hmm. They've been an afterthought. As somebody who's worked within the court system as a lawyer representing kids for about 2 decades now, we wait for cases to come into our system, and then we react. We react to deal with a problem that has already been in the emergency room, and we can't really control what happens next. It's too late. And I know, as a lawyer for children, for so many years, I asked myself the question of, if only we could have gotten involved to help the family earlier with the concrete needs that Amelia talked about a few minutes ago. I think of an example of a parent in Detroit that I worked with who had 5 children, was a domestic violence victim, and she was summoned to a family team meeting by the agency, and she was in a serious domestic violence relationship, and was told, if you don't get a protective order, we're going to take your children away from you. She didn't know how to navigate the system. She didn't have a lawyer. She didn't have anyone telling her what to do. So when the agency checked back within 24 hours to see whether she had done it, she had not. And her kids were placed within the foster care system, separated in several different homes. And she didn't see them for the next 30 days because she herself was in a shelter that was out of the city. And I keep coming back to her example of as I think about this idea of thinking differently about courts and the legal system as a preventable removal, right? As a way of us thinking differently about courts as partners in prevention, as not reactive, but proactive, right? What can we do? So a couple of quick examples, right? What if we reimagine courts as partners in creating programs to provide families with legal services well before a case ever enters the courthouse? Right. The idea, and this is kind of revolutionary, right? The idea that judges and leaders in the court administration should be actively trying to keep people from needing to come to court in the first instance. Mm-hmm, mm-hmm. And so, as an example, from 2009 to 2016, I led a program in Detroit called the Detroit Center for Family Advocacy, which, to this day will always remain sort of one of my the most significant contributions that I feel like I've made in child welfare, because we got families the assistance of a lawyer, a social worker, and a parent advocate well before they ever set foot in the courthouse to help resolve concrete needs like public benefits, getting a restraining order, resolving a housing issue, These are the things that Amelia, talked about, is if you asked families, like, what are the things they need help with? They need help with the landlord who won't fix the repairs in the home. They need help with the government office that won't approve their cash assistance. They need help with the school district that won't approve an IEP. And so we were able to do that over the 7 years we existed. And in a 3-year evaluation, not one of the kids that we worked with entered the formal foster care system or the court system. And so I think as we redesign how we approach child welfare, I think Amelia is absolutely right that it's not just the agency, that's a mistake I think our field has made for far too long, is that we've equated child welfare with child welfare agencies or child protective agencies. And we need to think broadly about ways that courts can work with and support families to keep kids from coming into care.
Yeah, absolutely. And, I've heard some of your other examples as well, Vivek, over the years, and they're always just incredibly compelling. I wonder if you could just share some immediate steps that we could take in involving and partnering with the judicial system around prevention.
Absolutely. So I think, one, as it relates to lawyers and really creating systems where lawyers are working with families to keep kids from coming into care. Courts and lawyers need to work within their communities to first have this conversation, right? Who within certain communities can provide this service? Right. It could be a legal aid organization. It could be a public defender's organization. There might be a group of attorneys that could do it. It could be a law school clinic. And thinking about and working collaboratively with the agency and the court to create this sort of system. I think, the federal government, thanks to your leadership and others, has funds available now, matching funds that can be used to create services. And so right now, as we speak in Detroit, there's an effort to revive the center that I led for 7 years, in part because this funding is now available. So I think one is start by having the conversation and make sure that you not only have lawyers there, but also agency workers who know what concrete needs these families might have, and then have families present in this conversation, have parents and youth there to talk about the legal issues that they confront. The other thing I think, and I didn't mention this in the beginning, but the other thing that I think courts can do to really bolster prevention efforts is to lead. And what I mean by that, what I mean is courts are not just folks who resolve disputes, but they are people who, when they call a meeting, others show up. Mm-hmm. And what courts and child welfare cases also have is, I think, a vast amount of experience identifying gaps in systems. Every time a judge at a hearing hears from a parent that some service is unavailable, the question he or she should be asking themselves is, what can I now do to make sure the next parent before me does not have that gap? So when they say there's no, for example, inpatient drug treatment program that allows a mother to bring a baby in, there's two choices you have. One is you could say, sorry, let's move on to the next case, and you're going to hear about that over and over again. Or you can say, that's a problem, and let's convene a group within our community next week to talk about how we can apply for a grant, or how we can go to a foundation or a government agency to fund this program that needs to exist. And from my experience, and I'm certain from the other folks on this panel, when judges call that meeting, people show up. And then I think the third part of that feedback loop, I think, is judicial practice. That when agencies don't respond to the concrete needs of families, then at that next hearing, in the next case, when the agency says there's no treatment program available, I think that's a sufficient reason to find that reasonable efforts had not been made to keep a family together, right? The question that, Amelia often asks is, what would it take? What would it take to keep that family together? Judges need to be asking themselves that question and think about how they can lead within communities to address the real deficits and the service gaps that exist. Yeah. So those are just a couple of things that kind of pop in mind as to what people can do.
Yeah, and you're hitting so many of our buttons here, Vivek. The whole area of legal representation, as you know, has been something that we regard here in the Children's Bureau as prevention, because as Amelia has articulated so well, when families don't have voice, they're often left out of the decision making and the planning there. So I'm so glad that you raised that. We are seeing, in some instances, I think, courts taking that leadership role that you mentioned, with incredibly positive results out there. Unfortunately, those are still the exceptions rather than the rule. And our goal, as I know yours is as well, is to bring some of those efforts to scale. I want to thank all three of you, but before we close out, I want to pose one final question for each of you to address. Is our participants in the call today move into the rest of today's program? There are a lot of different topics being discussed related to prevention, of course. I wonder if each of you could make one recommendation that you would give to our participants to help carry the information they learn about today into their work going forward. Amelia, why don't we start with you, if that's okay?
Well, Vivek just said my question, which is, in all cases, my favorite question is to ask, what would it take to keep this family safely together, and then do that. So, I really believe we are looking at a fundamental redesign of our purpose of how do we keep children safely with, not from, their families. And as we learn more, that really there's nothing more important and nothing more healing and nothing more predictive of lifelong success than having a secure, nurturing relationship with your parent. Then that really behooves us all to be thinking about our job really becomes to help parents safely parent, right? And so we move from rescuing and removing. We get out of the business, we divest ourselves from the business of family separation, and we begin to invest in the business of family strengthening, right? So thinking about how do we defund family separation and pre-fund family strengthening. And that means, if you're asking kind of one thing to do, that's at every turn. We say to ourselves, family separation has got to be the most nuclear option we use. It just has to come off of the table. And so instead, what do we do? What would it take? And what can happen to keep this family safely together? I was talking in Iowa with some judges who said, yeah, that's great, except, these folks, what do we do about that, except these kinds of families? And I listed off the top of my head just 4 alternative questions to ask for the judges. And since then in Iowa, they have done a pilot where they've asked 7 jurisdictions to ask these questions before removal, which has resulted in a 50% reduction of termination. And so I'm just going to read them quickly. They are, what can we do to remove the danger instead of the child? Yeah. Can someone in the child's family move, or someone the child knows, move into the home to remove the danger? Can the caregiver and the child go live with a relative or fictive kin? And could the child move temporarily to live with a relative or fictive kin? Mm-hmm. And so, can we move out the caregiver? Can we move out the child? Can we move someone in? And how do we remove danger instead of the children? So thinking about it in those kinds of ways of really reframing what we're up to here and thinking about creative solutions to keep people safely together, I think is the most important thing we can do moving forward.
Great. Thanks, Amelia. Mike, what would your recommendation be?
Yeah, in thinking about Vivek's comments, for too long we've thought about the child welfare or the child protective agencies as the agency responsible for preventing maltreatment. And we have to, you've heard different perspectives today from different parts of the system. We have to think very broadly. So I'd encourage you, as you go forward in your work, think broadly about what our child welfare, our child well-being approach should be in our communities. And as we think about partnering, as we think about doing things like Vivek described, where a court can take a role in leading and convening meetings, that we, one, aren't afraid of complexity. Our systems are very, very complex, and doing systems thinking to improve our systems is not about understanding all the components. It's about understanding how all the components work together and what emerges from those interactions. And so when we ask lots of questions, like Amelia pointed out, when we dig very deeply into our problems, we uncover those systems problems that are creating barriers to, for example, creating the treatment centers that we need to create and have available for our families when they need them. So I would say, one, think very broadly, broaden your perspective about what child well-being should look like, and two, don't be afraid of complexity, because our systems are really, really complex.
Yeah, great. Absolutely true. Vivek, what would your recommendation be?
It would be for judges and lawyers to see prevention as their issue, to see to see the idea that we need, as a system, need to keep kids from entering foster care as something that we need to lead on, and to start creating systems that help families resolve concrete needs well before they enter the court system. And I think, the example that I would use that I hope inspires lawyers and judges is that you see judicial leaders out there who have owned prevention as their own. I think of Judge Ernestine Gray in New Orleans, who wanted to keep kids from coming into care unnecessarily and redesigned her system and owned the decision-making process such that she saw a dramatic reduction in the number of kids in foster care. So I think for me, an example like that showcases the power that when judges and lawyers start speaking out and think about prevention as something that is within their job description and their role, really significant contributions can to a family's life can take place. But the first step is we need the folks on this, and they're listening to this webinar, the judges and lawyers out there, and the agency leaders, to see courts as prevention agents. And if they do that, then pretty transformative work can happen. And I think the hardest part of it is seeing it within your job description, seeing it as our obligation. And because I can say, when I started doing this work, I did not see it as my job to keep kids from coming into care. I saw it as my job is to work with kids in foster care already. And over the years, my thinking has evolved such that the greatest contribution we can make to families is to help them well be before they enter our system. But we have to persuade those who are leading systems, legal systems, that this is part of their work.
No doubt about it. And you cited an excellent example there with Judge Gray. Well, once again, I just want to thank all of you for your insights today, for your commitment to the work that's going on, and your commitment to prevention as a way of strengthening families and helping together. Some of the things loudly and clearly, as each of you has talked today, is just the importance of having a vision. We have to know where we're going, and in each of your remarks, I hear a clear vision, and one that's centered around the importance of family. Each of you has spoken to that critical importance. Whether it's in co-designing programs and lifting up the voices of parents and children and young people, or making sure that they get the kinds of essential services that all of us need in order to stay healthy, in order to stay together. The other thing that I've heard so clearly is the need to be very proactive, as you've articulated that in so many different ways, not waiting for someone else to move forward, but taking the vision that we have and proactively supporting a transition in the way we serve our children and families. So once again, I'll just thank all of you for that. And I want to thank all of our participants for being with us, and hope that this has been a helpful conversation to you all. So thanks again.
Thanks, Jerry and panelists, for that great panel. My name is Elliot Hinkle, and I'm a young adult consultant for the Center for States. And it has been my pleasure to work with my colleagues and peers to put together a video about what prevention means to us. You'll get to see that video now, and I hope you enjoy.
What prevention means to me is hope.
To me, prevention means reducing risk factors and promoting protective factors of families so that childhood maltreatment doesn't have to impact families as much as it does now.
Being able to take a situation and learn from the experts and learn from other people who have gone through those situations and be able to find a solution that will help someone else.
It would have had my son not leave home at the age of 14 to never return home. prevention would have had that support that he needed so desperately to be provided within that community. Since it didn't, I had to make a very, very difficult choice, one of the most difficult choices of my entire life.
A prevention-focused system would be a system that takes the initiative to be proactive rather than reactive.
As a community, we have marginalized populations within the child welfare system, and it puts a lot of responsibility, if we want to function preventatively, to go in the home and try and identify the root cause without treating the family like anyone is not important to stay in that family, like there is a better alternative.
It means that we're treating not the symptom, but we're treating the family as a whole unit.
I think about leaders that believe it is their true responsibility to provide training, commitment, resources, strong mindsets, and services to the people they are relying on to provide the services. That's where prevention starts.
Making sure that the community has the resources and the tools and the skills that it needs to continue to wrap their arms around a family who has a lot of strengths, just needs some support.
My hope is that in a prevention-focused world, we could create a way to support families without them having to be as involved in the child welfare system, that we can help them in their homes and in their communities rather than breaking them apart.
So that families can remain intact and be well and be whole.
Thank you to the panelists today for joining us and for sharing, and to the youth and young adults and families who took the time to share their perspective on what prevention means to them. It's clear that prevention means something different for everyone, but that as folks with lived experience, we can have a big hand in changing what we do in the system day to day and how we help youth and families. For me, as a young adult consultant at the Center for States, it's been key that I've been able to use my professional experience and my lived experience together to impact system change and to work with systems. I hope that as the day goes on, that you get to learn and engage in conversations, and you take things away that help you change the work that you do with youth and families. It can't be overstated that working alongside youth and families and utilizing their lived experience can make a huge difference in the work that we do every day. I hope you enjoy the rest of the day.